So please, those of you who are in the meeting, please keep your mics off. We will have an opportunity for discussion or questions with our guest speaker today at the end. So if you get questions popping into your head, please either keep them till the end or pop them in the chat, and we can pick up on them at the end. And the other thing just to say is that we are recording the session, so if anybody has any strong objections to that, please let us know as soon as possible. I think in the past it's been fine, but do let us know if you have any objection to that. So that's housekeeping done to get that out of the way. So we've got a great speaker today. We've got Irene Beautyman, who's going to tell us about no time to deal with one crisis at a time, delivering places for people, planet, and equity. So we're going to hear about how we can intervene in the urban and rural environment to improve places, deliver on all our national ambitions for climate action, improve health and well-being, post-COVID recovery, and improve equality in Scotland. So that all sounds like quite a challenge, all of that together. But no better person to tell us about this than Irene Beautyman, who is Place and Wellbeing Partnership Lead at Improvement Service and Public Health Scotland. She's also a commissioner at the Edinburgh Climate Commission and an honorary research fellow at the Urban Institute. And we're very honoured to have you here as honorary research fellow giving today's seminar. So over to you, Irene, whenever you want to start. Just start sharing screen, and we're all eager to hear what you've got to share with us today.
Lovely. Thank you very much, Harry. I shall just start sharing now. Thank you very much for that introduction. It's quite a mix of topics. A little bit of background to that is also that I come with a background as a planner who's worked in a town planner who's worked in local government for nearly 30 years before joining the Improvement Service and now working between the two organisations. Can I check, Harry, that you can see my presentation clearly?
Yes,
you can.
It's coming up.
Fantastic, thank you. Just so I'm not blethering away and nobody can see what I think I am sharing. Okay, so what I want to do today is no big ask there around that title that Harry just gave, and I want to just give a little bit of the background of the journey that we have been on at both the Improvement Service and at Public Health Scotland around just that triple win about what can we be doing with the places that we create, particularly, the creation of places is something that is the bread and butter of planning. And what can we be doing to make sure that when we have our interventions in place, that what it delivers upon isn't just resolving one issue at a time, but is actually looking to resolve on all of the crises that we are facing at the moment as we come out of COVID. So what I'm going to do is just spend a little bit of time about what place is and why it matters, and then more of the meat around what is it that we can be doing. What have we been doing, myself, my colleagues in both the Improvement Service and Public Health Scotland and beyond, what have we been doing and the journey we've been on, and where are we now, and therefore what lies ahead, what's the work that lies ahead for us. But just really to, as a sort of an opening reflection on where we are now is here, I feel. We are hopefully coming through a pandemic. I won't say out of it. We do have the resulting recession being talked about all the time. But as I keep saying, whenever I get the opportunity to talk, we have a huge wave coming at us around climate change. And given everything that's been happening in Glasgow in the past few weeks, then I feel our awareness of that is absolutely heightened. But we also have, within the impact of COVID, it's highlighted the vast inequality in our country, and that we're looking at not just the well-being of our planet, but the well-being of our people. Many of us are doing very well, thank you, and live in very nice places that help us to do that. And I count myself as being fortunate enough to be one of those. But for many of us, we are not, and dependent on where we live, there can be a vast difference in our levels of poverty, our health, our mortality, and how long we actually live a healthy life, not just how young we're dying, but what is the what is the word now? the quality of that life, really. The last 20, 30 years, are we living it with an illness, be that physical or mental, or are we actually living in a position where we feel that we can thrive? So while we have that looming ahead of us, at the same time, we have diseases now that are hitting us that are not the kind of diseases that we used to have when we got the NHS first set up, and you went into hospital and you got your operation and you came out and you were fit and well. We're now dealing with a series of diseases that can't be cured by a hospital operation, and are very much grounded in long-term illness, and are grounded in our behaviour and how we behave in our environment, and therefore that important aspect about the impact of the places where we live, work and play, and the proven impact that these places have on our ability to thrive. I feel that slide just highlights, obesity. We don't see signs like that. We see a lot of government health warnings around smoking, but nothing about that role of obesity, and nothing about the real struggle to deal with that because of poverty, because of inequality, and because of the austerity that has hit many of our public services that have been there previously to help those that are going through the biggest inequalities in our environment. So where we sit right now, we were there pre-COVID, and we're certainly in a more unbalanced situation now coming out of COVID, is always highlighted for me by this quote, that obesity, inactivity, depression and loss of community didn't happen to us, and rather we legislated, we subsidised and we planned it. And this is the heart of what, for me, place and the role of place in our lives, and the role of place making, place collaboration, whatever place-based working, whatever terminology you want to use, is the absolute nub of what is here. We do go into areas, we go into places, and we, with the very best of wills, legislate, subsidise and plan them in order to deliver a certain outcome. But what we really need to be doing, we have always needed to do, and we need to do even more so now given the crisis that we have, is to be considering the impact of our own interventions in light of how it will impact on other aspects of what we are not necessarily going in there to seek to deliver. A big example within the date of that, which was written in 2012, is that certainly for planning, it was all about delivering growth, no matter what adjective was in front of that word growth. That was what planning was given the brief as a national planning framework to deliver upon. And as we designed places to deliver growth, to deliver the right number of housing, to let the private sector thrive forward with that, what we were doing was building, in many cases, places that led to both the physical and mental ill health that we are seeing happening today, and that we are then years later having to treat in our communities. And that age-old thing of saying, oh, there's no community around here anymore, I think we have built that, but with the very best of intentions, because we had a different brief. That has changed. We are seeing the fact that we have a whole other set of waves coming at us, and that certainly has set the tone for my own and others' work over the past few years, is to address that and be sure that we're thinking about all of those implications. This really highlights for me where I feel we are at times when we're sitting in siloed parts, siloed sectors. My background in a council, sitting in a silo working in planning, not necessarily always speaking to regeneration and transport enough. Not that we're not speaking to them, but we're all working away on one part of the elephant and not seeing the big picture. And if there's anything that working on place is about, it's about looking at that bigger picture. So what then is place? What do we feel makes up a place? Every place is different. It can be difficult then to say, how do you do a place-based approach? But I think what's important is if we can just bear in mind that every place has some very common features that interact. And if we can keep those in our minds as we move forward with any intervention, it will help. Every place obviously has its physical environment, the street, the field, the space, the shop, whatever. It has the physical environment outside our door. It also has that investment aspect of it, and that's our own investment. We're all in some way paying, whether it be buying or renting, a roof over our head. We're all paying our taxes to keep the place outside our door in a certain state and order. And then we have all some means over the course of our life of receiving money, of working, of being able to afford that roof, and of working within the different sectors that look to also make money from our places as well. The other aspect is people, obviously, and the impact of what we go in and do on a physical place, and when we're looking at the economy, all ultimately impacts on people and thinking about that. And then what's really come to the fore more recently in the past 2 years has been that digital and online environment. It has changed how we've shopped, how we've worked. It has had a massive impact. So we can't really be thinking about place anymore without considering that impact of the digital impact on us, and the fact that that differs as well depending on what part of Scotland you're in and what availability you have to that. So why does it matter to us? Why does it matter that we think about those unintended consequences of doing one thing for an intervention for the very best of reasons? What are the sort of unintended consequences we can be leading to? Here are just two examples based around something that's very to the fore at the moment, which is traffic and our car-orientated developments. And just, the fact that we do say there's too much traffic, so we're not going to walk to school, we're going to drive our child to school and augment it. So in seeking for ourselves personally and seeking to deal with an issue, we're adding to the issue and not thinking ourselves about the unintended consequences. But likewise, when we think about the areas that we plan, we can be doing the exact same. We can be creating cities that have suburbs that are car orientated in order to get from that housing estate of 400 houses, of 3 and 4 detached villas. You can't get to anything without getting in your car and driving there. And in doing that, you're blocking up the roads of other people who are living elsewhere. I live in Corstorphine in Edinburgh. It would be a village if it weren't for the fact that we have everybody travelling right through the middle of our village. And it doesn't feel quite as much of a village as it could do without that. So we have our own personal unintended consequences. But then when we're thinking about the places that we plan, are we always thinking about those unintended consequences? And that's what we need to be doing, to be thinking about that triple win and what we're doing. The National Planning Framework's just out a couple of weeks ago, a week ago. And for the first time, what was set out in the Act that came in 2019 was that we have an actual purpose for what planning is doing around its role in place. So that is managing the development and the use of land in that long-term public interest. And that's the interesting aspect that we need to get down to the nub of. What is the long-term public interest? And in planning, we spend a lot of time debating that, consulting on it, debating it at inquiry. What is that long-term public interest? And if we don't get that right quickly as possible and be as clear on what that is, then we're not going to be able to take the actions that we need to be taking to deal with those waves of things and crises that are coming at us at the moment. When we look to public health is very much like planning, and that explains why I sit between the two organisations. And that definition, the second bullet there on the right-hand side, gives that definition of public health as the art and science of preventing disease, prolonging life and promoting health through the organised efforts of society. And I find that interesting because that's planning as well. We are looking to organise the efforts of society to do the exact same, to be prolonging life, to be enabling people to thrive and to prevent them getting the diseases that the NHS then later on has to pick up and deal with. So what can we be doing? Where we are, I'm going to split this into two areas that I feel we need to be addressing, and that many of us that I work alongside and across Scotland are looking to deliver. One is we need to get an awful lot clearer on what makes a great place, and we need to do that as soon as possible. We then need to get better at collaborating in order to create places like that across the whole of Scotland, and not have many parts of Scotland that are sitting within the bottom 20% in the deprivation index of multiple deprivation. Sorry, getting myself tongue-tied. So what we need initially, and why we need to define what is important about a place, is that we need to have clarity and consistency of what creates a good place. And at the Improvement Service at Public Health Scotland, and with colleagues that I've been in conversations and working with across COSLA, Directors of Public Health, Edinburgh University, Heads of Planning, Health Improvement Managers, apologies if I missed anybody out there in that list. That's exactly what we've been looking at. If we can't define what is it that makes a place great and what makes it thrive, then how are we going to consistently make sure that that's what we deliver upon? And what we have spent time coming up with across all of those organisations has been a set of place and wellbeing outcomes. These are the characteristics that if we get these right in every place, then those living there, working there or relaxing there will have the greatest opportunity to thrive, to get out into that place and to take part in society and to live a life where both their physical and mental health has the opportunity to be at its maximum. The actual wording around these place and wellbeing outcomes is on the Improvement Service website. I encourage you to take a look at them. They sit behind a set of evidence that was prepared 5-6 years ago now in order to shape the questions of the Place Standard tool. In order to shape those questions about how do you have a conversation about a place, they looked at what are the characteristics of a place that actually mean that you're getting everything right. You're not just getting active travel right on its own, you're getting all of the aspects of a place maximised there in order to be able to make sure that in the round you're delivering the best possible place for folks to thrive within. So we've spent time developing these, but they really began back, as I say, with that evidence that sat behind the Place Standard tool. And if I can just talk us through just one example of the very first theme around those, and I'll come on to the different themes that are sitting there in that bit of pie I just showed you in a moment. But if we look at the first theme about it and moving around, if we think about an intervention we can be making in a place, such as improving walking and cycling infrastructure, what we're after is that behaviour impact that I was referring to earlier. So if we improve walking and cycling infrastructure, we improve physical activity, we improve interaction with nature, we improve social engagement. Simply walking past somebody first thing in the morning and making eye contact has an impact on our mental health. And what we also do is reduce that travel cost that has many of us being forced to buy a car or to buy a second car and not be able to have that disposable income to spend on other things. It also means that more people start to walk and cycle and move around and access public transport, which then starts that upward cycle of use of public transport, which improves frequency, cost for all of those third of households in Scotland that don't have access to a car, half of households that don't have access to a car if you're living in a deprived area. And that starts to track across. That behaviour change then impacts on our physical health, our mental health, it impacts on our early years, our learning, impacts on poverty and inequality because there are better bus services around. And that all translates across into actual health outcomes, reducing obesity, reducing congenital heart disease, reducing diabetes, stroke down, cancers down, and improving mental well-being. That link between the interventions that we make when we work in our urban and rural areas directly goes across into having an impact on our well-being. What's important, though, is that each of these interventions also impacts on our economy, the liveliness and the whether the area itself is thriving, and it also impacts upon our planet and its ability to thrive as well. Now, I said I'd refer to the main themes in the place and wellbeing outcomes. They go around, starting with that one at the top around moving around. How do we move around? Where do we park? Active travel, public transport. There's that theme, and making sure that we maximise all of those and the opportunity to access those in every area. Then there's a whole theme around spaces, green, blue, grey spaces, that we maximise the opportunity to access good quality space that is suited to all parts of our communities. Then there's that middle pink area, which is very much around our ability to access the resources that we need in a place. Affordable housing, fair work, shops, amenities, services, all locally accessible for everybody, and also that ability to feel that you're part of that place as well. And then we come into the bottom two areas on that left-hand side, which are far more about our feeling for that place. And they're absolutely crucial if we wish people to step out their front door, and change their behaviour, and move and walk and take part in a community. Then people need to have a sense of belonging for that place. They need to feel safe when they leave that front door, and they need to feel a sense of stewardship and influence over what goes on outside that front door as well. And all of these track across to just the very same set of health outcomes that I had highlighted there. They track across, they improve our health outcomes, and they also improve our planetary outcomes as well. The place and wellbeing outcomes, as I say, I urge you to have a look at the Improvement Service website. Just Google Improvement Service Place and Wellbeing Outcomes, they will pop up. These are the elements that, if we get these right, we can be delivering on so many of the national asks that we have in Scotland at the moment. They start off in the fact that they're preventative, they're long-term, they're the role of place in preventing our ill health of both our people and our planet, and they can be used very specifically when we go in and work in areas that are within the bottom 20% of deprived areas. That is how we can reduce the inequality in our country. But they are long-term, they deal with the problem, they don't put a sticking plaster over the problem, and they require us to work together in partnership, both within the many, many siloed aspects that can sit within organisations, between organisations, and within different sectors in every place. If we're going to deliver on all of these aspects, because that's the important thing, is it needs them all delivered upon, then we need to be working together on them and in partnership. Delivering on these meets, as I say, a number of ambitions that we have being asked of us at the moment. 20-minute neighbourhoods, they are a means to deliver that kind of local living. Right up there at our sustainable development goals, our national outcomes, they are places aspect into contributing into those. They also deliver around aspects such as the new future for Scotland's towns, our net zero emissions, and the public health priorities that we had defined for us 2 years pre-COVID. They deliver upon all of those, not just the top place public health priority, which does happen to be place. So when we're delivering place-based approaches, certainly myself and my colleagues would say, these are the outcomes that you need to be seeking to deliver upon. These are the outcomes that you need to almost run a lens through when you're doing any work. And I'm going to give a couple of quick examples of place-based working that can be delivering upon these outcomes. The first is community wealth building, and the second is very much the 20-minute neighbourhood, or the living locally aspects that we've been hearing a lot about from the Scottish Parliament recently. Both of these, again, on the Improvement Service, there's briefing notes that go into an awful lot more detail. So if you're looking for more, I urge you to have a look there. Community wealth building, I just want to give a very quick example of what community wealth building is for me and the advantages of it. It is so much about our anchor organisations, and that is what's set out in that text from the briefing on the Improvement Services webpage. But I think what brings it to light is if we look at what West Dunbartonshire Council did with their council offices. They had old offices on the edge of Dumbarton. You had to drive, you had to park to get there. they needed to replace the offices. The cheapest option was an alternative office in Clydebank, again on the edge of town. That was the cheapest option. However, at the same time, they had Dumbarton Town Centre that was not thriving, that was struggling, that local people were not feeling happy and safe in. It also had a large vacant building, had been vacant for 30 years. They made the decision to not take the cheap option, but to take the long-term investment in their place and revitalise that building, add on offices to the back of it, and bring their staff into the centre of town, next to the train station, spending money in the town and making sure that people were no longer having to drive to get to work and were actually creating a thriving town centre. They also made the decision not to put a cafe in it so that people would go out and spend money within the town centre. That, for me, always epitomises community wealth building, where you're using your procurement, your staff and your assets, your buildings, in order to think about the place, not just about the cheapest option. 20-minute neighbourhoods, we've all been aware of them ever since Nicola Sturgeon talked about them in last year's programme for government, that we're about looking at local living. Absolutely crucial. We don't get hung up on 20 minutes or 15 minutes in Paris or whatever. The absolute emphasis is that they are about creating places where we can live locally, where we can walk to our daily needs in order to have a healthier life, but also a healthier planet. But what's really crucial, and why we can't focus too much on 20 minutes, is because they're about people, and they're about the variety of people that are in that image on the right hand side. We need to be thinking, when we create places, about all of those different population groups in a place, and considering the impact on a place for all of those people. Thus the number of minutes becomes really very irrelevant. We've looked across the world for what they've done, and Melbourne have set out all of the crucial elements of a 20-minute neighbourhood. For ourselves, as I'm saying, the place and wellbeing outcomes meets these elements, and I think actually goes in a little bit further to talk more about the importance of feeling that sense of influence of your place, over your place, and safety. I think that's an absolutely crucial one. A lot of that has been reflected in the national planning framework that has come out, but we can map across what we've been looking at in Scotland with the place and wellbeing outcomes with what's been happening across the world in the likes of Melbourne. So what have we done with these place and wellbeing outcomes? Well, myself and many colleagues across the organisations I listed before have been working together to use the place and wellbeing outcomes to assess what's happening at different scales across Scotland. And we used them as a pilot to look at 3 different levels of place, of intentions, framework, policy for a place. One was a development site, one was a whole council local development plan, and one was a regional spatial strategy for a large rural area. And we did that quite deliberately to see how do the place and wellbeing outcomes apply themselves when we look at those different scales. When we look at a document, a framework, a plan, and ask ourselves, what more could we be doing with the essence of that and the scenario that sits behind that framework or document or plan to make sure that it is actually helping all of the different populations that were in that image, parts of our community? How does it run through delivering on all of the place and wellbeing outcomes? And also, how does it deliver around our national performance framework checklist as well? And in each of these 3 assessments that we carried out, we identified a set of key issues and recommendations that were saying, if in taking forward this bit of work, you would like to deliver more and make sure that, as well as delivering on the ask of that document or framework, you're thinking about the well-being of people and planet, and you're thinking about equity and all of those population groups, then here are a set of recommendations that we can be taking on board. Again, all of those are on the Improvement Service website and on the SHAN website as well. So, one short example to give into this, just to bring this to life a little, was the very first of those rapid scoping assessments that we did to test out those place and wellbeing outcomes, where we looked very much at the 20-minute neighbourhood scenario. Edinburgh Council were looking at that as a possibility for their local development plan. as opposed to the more traditional scenario of what they had been delivering and what many local development plans across Scotland have been delivering, which is low density housing and semi-detached, detached gardens, limited mix of uses, lower critical mass in order to even support local services, and a very road and car orientated approach to delivering on a local development plan. As opposed to a different scenario there where we look at higher densities, a mix of uses, reusing as much brownfield land, and because of those higher densities, enabling to have enough people in a small enough area that can support services, shops and amenities to actually thrive rather than fail. And in doing so, we can reduce car usage as we go. And what we found within that work was that there was a real importance as we move forward and as we think about our delivering on those place and wellbeing outcomes, we need to think about density as we move forward. There's a sweet spot here. We're not wanting to go back to the 60s and high rise, not in the slightest. But if we can be thinking about building at a higher density than the suburban sprawl that we're currently doing, then we can actually build that critical mass that enables us to have local services and amenities retrofitted across our urban areas and as we expand into new urban areas as well. Crucial that we put in that infrastructure, especially for active travel and public transport, and that go in first and begin those habits when people are stepping outside that front door. But getting a mix of housing type and size and different tenure as well is crucial for people to be able to, we have an ageing population and we want people to be able to age in place. So that was certainly something that came through that work. As I say, critical mass is really important, but so is good design to ensure that people have good social contacts as they move around a place. Those little places where you pass each other and find yourself just saying hello to somebody where you maybe wouldn't normally have done so. You're in an urban area and you carry on past, creating those places for people to build those little contacts that help our mental health. And overall, reducing the travel benefits, that just means that we're really looking at that equity, those that don't have access to a car, those that that do have a household that has access to a car but are young and they do not have access to that particular car. It just means that we're actually helping with those inequalities for so many others if we think of other ways of moving around and travelling around our areas. So that's where we have been. That's where we have been doing those rapid scoping assessments during COVID. We were completing those, and where we've got to now with those place and wellbeing outcomes, we've evaluated that process, and now we are looking at pulling together that into a document that will advise on how to do these rapid scoping assessments around what is the impact of a place on our wellbeing. What we're also doing at the moment, and this is very much a partnership between the Improvement Service and Public Health Scotland, is moving forward around these place and wellbeing outcomes. We'll be preparing a guide around the place and wellbeing outcomes themselves, setting out a little bit more detail on them. Really much of what is already on the Improvement Service website, but just capturing that. As I say, we'll do a guide on how to do those scoping assessments around place and wellbeing. And all of that will inform a programme that has just been started earlier this year between the Improvement Service and Public Health Scotland that is very much about joining up those opening comments that I had at the very beginning, those aspects about the fact that we have spatial planning, so that's land use planning, roads, transport, housing, regeneration, all there about how do we manage our land in the long-term public interest, and then the fact that public health likewise are looking to organise the efforts of society to keep us well. How do we link those up, given that it's councils that have a lot of that within their remit? So the Shaping Places for Wellbeing programme is about linking up those two organisations with what's happening locally, what's happening with the council and what's happening in the local health board, and linking up to work together more proactively on delivering greater places and consistency around that using the place and wellbeing outcomes. We're beginning that work in 4 different areas, in Clydebank, in Alloa, in Ayr and Dunoon. And that's to get some actual action happening on reducing inequality. We've picked those towns because they are suffering from inequality, and we're going in with a very unique offer where we're beginning by looking at what is the data telling us about these towns, what are the inequalities in that town, and what are the demographics that are suffering from that inequality. That will then allow us to be very citizen-centred, not going out doing consultation that sits in a library hall on a Tuesday evening, but actually going and directively speaking to those that are suffering from inequality in the area and thinking about the impact of our plans, our frameworks, our policy on that demographic who are suffering. And then, as I say, looking at what all is happening in these towns. What are the different plans? We know each town will have a local development plan, we have place plans, we have community action plans, we have local outcome improvement plans, locality plans. It goes on and on and on. How are each of those running that through the lens? And what are the things coming up in the next couple of years as we work with these towns over and through to March 2024 when we finish, that we could make sure that they are beginning to think more and run it through the lens of that demographic that are experiencing the biggest inequality in an area. How can our places and what we do with them help in reducing that inequality? So another aspect of that as we move forward, just to raise awareness of it, I think it helps, is that we'll be pulling those 4 towns together to learn from each other. We're going to pull in a further 4 towns that we will mentor. Unfortunately, the funding that we got allows us only to put in actual physical support, people on the ground in those 4 towns that are listed there. We got funding from the Health Foundation and Scottish Government, but we have a further 4 towns that we're going to work with and pull them in order to capture the learning. And then we're also going to be working with another 4 learning areas. Folks who are already doing stuff, the likes of Edinburgh Council, already working in Wester Hailes with a 20-minute neighbourhood strategy that's been through their council and been approved. Let's learn as we go. That learning cohort will also be sharing nationally. The Place and Wellbeing Alliance will be one of our means of doing that, and watch the space for other means in which we will be sharing that learning as we go. And then the final aspect of this programme, which is really crucial as we think about how we address that triple win and all the asks that are coming down that I listed earlier on national ambitions, is that what do we need to change nationally in order for all of this local work to actually have a greater effect? What are the kinds of things that, while we're being asked to work more collaboratively, we still have a national ask to get measured in silos and get funded in silos? What are the data asks that would really help us to identify demographics who are suffering? Have we got the right data? Does it sit nationally? Is it within the power of our Scottish Government to actually pull that together and help with those processes? So that is where we are working towards at the moment, working with 4 towns, but very much looking to develop a narrative around what we can be doing, what can places be doing in order to deliver on all of the asks. Let's look at all of the asks that we have and make sure that our places contribute. There are other things that will contribute to all of those waves that were coming in, but let's make sure that our places make their maximum contribution, and they can do that by delivering on those place and wellbeing outcomes and by learning about the different processes that we need to get into in order to collaborate together. This is very much back to Christie Commission principles and to working on long-term prevention rather than dealing with the problem in a sort of a short-term sticking plaster approach, which can be the obvious place to go when we're dealing with austerity. It can be quite a struggle. Place is a long-term means of doing that. The Shaping Places for Wellbeing programme, as I said, runs till March 24 at the moment. This is our timetable where we are. Orange was us co-producing the programme. Pink is where we are at the moment, where we're getting ourselves organised and mobilised. And that purple band down the middle is where we will be working with these places and sharing the learning over the next 2 years. So I encourage you to keep looking at our website follow us on Twitter and keep in the loop and let us know if anything that you're also learning about and what data you're coming across and learning about that would help with that story, because we really are about this not just being 4 towns, we're about this being an approach for what police can be doing across Scotland. My hope is that when we finish up in March 24, we have other towns to go on to support, but those that we've been in and been working with, it keeps going. This doesn't stop because we've left. We've delivered a system change that understands the importance of those police and wellbeing outcomes. I shall stop there because I've gone a minute over and talked too long. My apologies, Harry. I'll stop sharing.
No, please don't apologise. That was a terrific presentation. Thanks very much for sharing all of that experience that you've been having over the last few years, actually, but the more recent experience as well. And let's see if we've got any questions. I haven't seen anything in the chat yet. So while people are putting their questions in the chat or mustering the courage to raise their hands. Oh, somebody.
While folk are, could I just say one other thing? Because I'm aware that you mentioned that you do have obviously got students listening in. Those rapid scoping assessments that we did also highlighted research questions that we felt were sitting there needing answered. So if anybody's looking for a selection of research questions, I urge you to have a look at those, particularly the first one, first and second, I think, but all of them, I think, had research questions in there. So they're just sitting there awaiting. We have moved forward with some of those, but yeah, I think it's important as we go and that's something that we do through our work is highlight where there's always a need for more research in areas, and that we identify those and spread those as we go as well. So I'll stop.
Thank you. That's a really nice pointer. Scott, you got a question or comment or both?
Yeah, thank you. And thanks for that, Irene. It was quite interesting 40 minutes or so. And I can tell you've got a lot of passion for the subject, which I think makes it easier for people like me to engage with it. The 15 or 20-minute neighbourhoods makes sense to me because I'm old enough to remember that that's kind of how things used to be in the past, where people live closer to their relatives and closer to their workplace. And I guess one of the challenges we have is a lot of us, including myself, you choose where to live based on largely, well, partly on the convenience that comes with owning a motor car, etc. So I think a lot of what you're talking about is new developments, but how much of a challenge is it to fix some of the existing developments to try to get them into this framework and also change the culture around how people select where they're going to live?
Yeah, the bigger challenge is the retrofitting our current urban areas. You know, the new development is only 1% of what we're dealing with. We certainly shouldn't be seeing any more car-orientated housing estates. They should be 20-minute neighbourhoods that are being created with that local living. But when we look at our current areas, we have town centres that are needing reimagined now. Retail has completely changed, as has home working completely changed things. So we need to be looking at a new role for those town centres as places in which to come and live, and as a focus almost for the public transport and the cultural hubs that we need that are not meeting our daily needs. But as we start to look at the estates that we've been building for decades, that is the biggest challenge. Where are the spaces there for people who are now working from home to actually find hubs, to be able to find local services and amenities that they can actually walk to? And that may mean that we need to revisit what we're actually doing when we're looking at our local development plans. And we have whole swathes that simply wouldn't allow anything beyond housing in an area. We need to be looking at what are we doing, not just with those spaces and buildings. We have got buildings across, and come back to the role of anchor organisations here, buildings across Scotland that are no longer needed by councils, by NHS, by those that are saying, actually, you only need to come in 1 or 2 days a week. Selling them off to the highest bidder is not the best approach. Thinking about how they can become a hub for a 20-minute neighbourhood, that is the better approach, and is to be thinking that kind of long-term approach around that, so that we can start to retrofit those areas that we've built, because they're by far the bigger challenge.
Yeah.
Could we also just have no more drive-throughs as well? I was making the point to the new minister yesterday. I asked him about his opinion on drive-throughs and having a moratorium. He declined to answer my question though.
Yeah, I kind of understand the market need for a drive-through McDonald's. I'm not that I use it, I have to say, but drive-through Costa Coffee, I just don't understand, because to me, coffee is a bit relaxing, and not for driving a car while you're drinking. But I guess maybe there's a niche there for someone, I don't know. But think about the bigger picture, though. I mean, you've very much focused on the urban scale. Is there a tension between this move to 20-minute neighbourhoods, while simultaneously in Scotland we see a lot of investment in roads between towns to make it easier for people to drive longer distances, whilst at the same time we've been told that we have to stay in our neighbourhoods? Is there a tension at national level between those two policies, or do you see them as compatible?
I think there's a few points in there. We're not being told to stay in our neighbourhoods, and I have heard a lot of people say that about, oh, now we're just creating ghettos. No, what we're seeing is you can stay local for your daily needs. That's it. If you want to go to the pictures, you're not going to get that within your daily walk. There are many things that we would go to that are not daily and that we would leave our area, but we would like to have that it is not by car, that it is by public transport, and you have that access. There's a tension that one of the rapid scoping assessments that we ran was on that large regional scale, and we deliberately chose Argyll and Bute to look at the delivery of the place and wellbeing outcomes. How did that work? A 20-minute neighbourhood in an area like Argyll and Bute, which is massive. How do you work when you've got such a large rural area? And what we reflected on and recommended was that in any rural area, there is an acceptance that if you're in a hamlet of 17 houses, you are going to get into a car to go to your nearest town. And we all identify with our nearest settlement. That's where we say we live outside so-and-so, this place, that place. And it's these settlements and towns that need to become the hub for a 20-minute neighbourhood, so that once you get there, you're getting as many of the services, amenities, the links into other public transport as well as you possibly can, that mean that you're not driving a further 30, 50 or 100 miles to get on to something else, that you're getting as much as you can, and you're certainly getting onto public transport that will take you there as soon as possible. The car-orientated building of roads, well, I think we've had a lot of coverage about the fact that needs to stop, and that would certainly be my recommendation, is we need to stop doing that. We need to be investing in active travel, in walking and in public transport. That's got to be the future in order to make that the enticing. It's a bit of both a carrot and a stick, that means it's an enticing option and choice that we are choosing. And the amount of money invested in building roads, if it were invested in public transport, in rail lines and so on, could make an immense difference on that when we look at the proportion of a budget that's spent on one as opposed to the other.
Yeah, there's controversy in Edinburgh just now because Sheriff Hall roundabout's going to get upgraded, and that's going to cost £125 million, which is I just can't get my head around that. But I'm a civil engineer, so there's civil engineers doing lots of work there, so I guess I should be grateful for it. But I still do have questions about it, to be honest. Thank you. Thanks for your answers.
Scott, I think that last comment gives me a cue for a question I wanted to ask, because I think the conversation has been very much about the clarity of what makes a great place, as you put it, Irene. So, and then the second point you made earlier on was the need to collaborate to create that place. So in terms of the clarity, I think there's quite a bit of consensus among the audience we might have in this event, for example, about what is that great place. We've all been moving in that direction in our thinking, some from further back, others more recently. But that doesn't mean that everybody out there has the same idea of what a great place is, or doesn't have the same type of interest in how a place is developed, such as what Scott was kind of half-jokingly referring to as what money you can make out of designing a flyover. So we go back to the whole discussion we had about collaborative planning back in the 1990s, when it was being really put forward as the way forward. But then the criticism was, well, but it isn't a level playing field. There's lots of different interests, different ideas of what should be done and who benefits at the end of this. And in my own work, in my own research, we actually do action research and we collaborate with both the local government and communities, and this is in Latin America. And even when we have all a kind of consensus around what we're trying to do, there's all of these different agendas in the different sectors. So very much what we've been hearing from you is things that are in the public sector or led by the public sector. But when you get into the messiness of all the different actors, public, developers, public sector, trying to pull together to what we're presuming is a shared vision, but I think there isn't necessarily always that shared vision. How do we achieve that? What's your experience in how do we actually achieve that second component, that collaboration that seems to be key? So it's not just about the idea of what a good place is, but how do we actually get everybody to work around together to get that in place? Sorry, it's a long lead up to the question, but
I think until we get the absolute clarity on what makes a great place and we consistently define what that is, that then drives the collaboration. The National Planning Framework, as I said, has come out. It, for the first time ever, isn't just asking planning to be about delivering growth. It is asking planning to be about delivering on equity, on well-being, on our ageing population, on biodiversity, and on climate. There's a whole other raft of things that it's asking around. So that top-down drives collaboration because we are being asked to make those considerations with the clarity that I would say at the moment, having scanned, I have to admit, just scanned the 130 pages of the National Planning Framework, there's insufficient detail in there. So there's an ask around if something is moving forward and delivering on a local living 20-minute neighbourhood, it should be supported. And that opens up that door to a lack of joined up thinking, while what we will spend our time doing is between the public sector and the private sector arguing over what actually is a great place. This is a local living place. No, actually, it needs to include these things. No, it doesn't have to say that because national policy didn't actually set that out, that it had to explain that. So we don't need to do that. And we will spend our time and waste our time having arguments over what those actual aspects are. I was at an event yesterday where Craig McLaren was saying, that's head of the RTPI in Scotland, was saying there's just not enough detail here about what is making a great place so that we can all consistently agree on that and then get together and work together on it rather than sitting disparately arguing about we are creating a healthy town and we're creating a 20-minute neighbourhood. But actually what we're doing is putting in some cycle lanes and those cycle lanes don't really go anywhere. They might be used on a Sunday in the afternoon in the summer by a family, but they're not going to be used to get to work and to get to public transport and onward journeys. So we need consistent clarity on all of the aspects we need to be delivering upon. And if we could just get that set once nationally, we have a national planning framework now that setting policy for us is enshrined policy, then we could stop wasting time and get on with that. And that is what would drive collaboration. Then using the kind of many processes, including, as I say, the rapid scoping assessments that we have done in order to assess what we're doing, that involves pulling together. And when we did those assessments, they only took half a day, but we pulled together people from the health board, from different parts of the council, from community planning, and different sectors and areas. And that was just rapidly scoping something out and doing it as a pilot. We could be pulling in other sectors and having that conversation as well, but with clarity as to why we're doing it, because we know that these are the outcomes that we've got to be delivering upon. So everyone would get round the table to look at how do we do it rather than should we do it, which is where we are potentially at the moment.
Okay, thanks, Irene. I think it's a really interesting answer because it does, I think you've flagged some of the things that I think underlie this difficulty in getting that collaboration, because you mentioned the top-down drive, the need for this clarity from top-down, but it's in a context where our planning system is very much market responsive, for want of a better word. So there's that tension between this drive that you're referring to and how at the ground level, when we're looking at particular individual developments, how it actually operates in practice. And what are the tools that are in place there to enable that top-down drive to actually be implemented? I think this kind of, I'm not sure if structural is the right word, but there's these things about how the system works in this country that don't necessarily facilitate that quicker kind of establishment of common norms and standards, I think. Have we got any questions, Lisa, in the chat?
No, there's
no
questions in the chat.
Okay. We've got.
Can I ask one more question? Can I ask one more?
Nobody else. Yeah, nobody else is raising their hand, so go for it.
It's another novice question. I'm not a planner, Irene, so please forgive me. So I'm aware that in Edinburgh, when it comes to the the 15-20-minute neighbourhood, I think they've been, rightly flexible in how they decide what 15 or 20 minutes is. Whether or not, for example, it should include public transport, etc. A small trip for some services. So I think that's I think that's a good idea, to be honest. I'm a big fan of public transport, but we're also aware that they're also looking at the 20-minute neighbourhood to think about how they can manage their budgets. So one thing, for example, they might say, well, within 20 minutes of you, Scott, you've got 2 libraries. Perhaps you don't need 2 libraries. Let's close one of them. So are you aware of other councils? Are you aware of that happening, where perhaps it's been used in that kind of negative way, if you like, to actually remove services rather than actually bring people closer to services?
I'm not actually aware of Edinburgh Council using that as an approach. What I would say is that it would be quite difficult to apply, because every one of us lives within our own local area, that you can't put a cordon around and go, here's so many areas, because nobody's living on the edge of a 20-minute neighbourhood. We're all in the centre of it. So it would be challenging to be able to say, oh, you live in an area that has 2 libraries, because somebody streets away won't. So it would be a challenging one to do. It's certainly not something that I've been aware of. It's far more about looking at local services, therefore thinking smarter about the use of our buildings, so that it's not just a library, it's also linked into other services and other amenities, and has a dual purpose, if not far more than a dual purpose, rather than closing things down. Likewise with schools, thinking about their role out with school hours, thinking about their location, that they're not relocated to the edge of a town simply because that's a nice cheap greenfield site to put it at and sell the site in town for housing to fund it. That makes sense to a council that has been hit by austerity. Yeah. In the long term, the impact it's having on those people, I would say it doesn't make financial sense, because ultimately there will be a bill to be picked up in order to that has resulted in people suffering both in their health, well-being, and the impact on our planet of everybody then driving their child out to that school as well. So I would say it's the approach has been far more that I've seen like West Dunbartonshire, with thinking about their asset and how they use it, how they use their own staff to help a town to thrive, and how they use their procurement and what they buy. And if you think about the big organisations in an area, they have a lot of buying power. If they choose to buy more locally, they can be supporting local businesses, rather than the investment simply goes off to shareholders in wherever across the world.
Yeah, so I think 2 things there, really. I think it's probably the wrong time to talk about, people having more local services sourced inside schools, because these days, largely people are kept out of schools for a good reason, because of the pandemic. But I think I'm a big fan of that, actually, because they are big resources, which quite a lot of the time basically are empty, particularly weekends and things. So I think that's a good part of it. The other part about, using council procurement as an economic driver, that's the so-called, community wealth building. I think hopefully that's going to be adopted in a meaningful way. I think Preston is a place where it's been used to great effect. And I know in Edinburgh, the contract for the Winter Festival is coming up for review, and I think they're very much looking at that approach, where local businesses can get involved in delivering those Christmas markets, rather than, dare I say, people from quite far away, because that's where the money ends up. I think it's better that local businesses benefit more, actually. So it's good. It's good that these things are connected together. I never drew the connection between a 20-minute neighbourhood and community wealth building, but it's there. Okay, thank you.
to be honest, they're more successful when they do get linked up. I would suggest you have a look at, what North Ayrshire are doing. They have a community wealth building strategy that they've been progressing, and the rapid scoping assessment that we do of a framework looks at how they've actually brought a secondary school closer into the town centre to support it to be a 20-minute neighbourhood, and the role of the school, it goes beyond purely education, it goes into the community having that use of the school and that access.
Excellent.
I think suddenly all the questions have started flooding in the chat just when we were about to finish, but have you got another couple of minutes, Irene?
Yeah.
Yeah. Okay, so I think Denitsa Petrova had actually put a question in the chat, but also raised your hand. Is that right, Denitsa? Do you want to actually?
I just wanted to point attention to the fact that I put question in the chat. That's all. Thank you.
All right. Well, do you want to just ask the question, or should we?
Yeah, I was just wondering if you engage with any artists working in public space or with community work when you're doing consultation, if that's being considered. That's all. Thank you.
We haven't personally, no. I mean, in working in the 4 towns that we're in, we're certainly nowhere near that stage at the moment. Public artists and artists is something that used to be part of even planning consents. There would be a percentage for art, but that has gone by the wayside as far as I'm aware over the years. But it's an absolutely crucial part of that sense of belonging, which, as I say, is one of our outcomes for delivering in every place. It's keeping old buildings that people recognise, but it's also having local art and local artists. And that's important also with our ageing population, because it's aspects like that that enable us to see where we are, and when we're building and creating places that are suitable for those with dementia, that they can locate where they are as well. Then the role for art in doing that is really important. So I certainly think it is important. I have seen good examples of it across Scotland, but it's not there as standard in the way that it really ought to be.
Okay, thank you.
Thanks, Irene. We've got 2 final questions. Please don't put any more in the chat, and we'll ask Irene if she can answer these 2, and then we'll call it a day. So one question is, I was wondering how the role of technologies is being considered. For example, the concept of smart cities. Is there any thought given to the way in which this concept can be incorporated?
Good question, and I think it's one that we need to get to grips with more as we're working on our Shaping Places for Wellbeing. Our focus has been far more about the impact that has had on our behaviour change, rather than the absolute benefit of smart cities and what we see happening across Europe in order to actually facilitate far more active travel. And when I think of smart cities, I think of I think it's Copenhagen, where the traffic lights are all set up to go at the pace of cycling, not the pace of driving, and that we really use technology to actually help, and that's certainly something that needs to be embraced more. I think the cities are leading the way with that, which is understandable. The bigger urban areas will be doing that, and that there's a lot more lying ahead for us on it, but I haven't been as aware of it being applied. I know that there are others in Scotland doing a lot more work on it than myself.
Thanks, Irene. And last question here is, in the presentation, you compared Scotland with Melbourne. I know Melbourne, some part of the public transport network, namely the tram, is partially free. Do you think this price setting for public transport is a motivation for people to use public transport rather than driving to avoid becoming a car-oriented city? If so, how much feasibility do you assume when it comes to lowering the price of public transport systems in Scotland?
Oh, let's just make it free. I've heard a lot of people just in the past month talking about that we can talk about a universal kind of basic income for everybody, and another alternative has been, let's just make public transport free. If you consider what's happened across, certainly in Edinburgh with Lothian buses, but other bus services, they've been getting assistance through COVID because they continued to run to get essential key workers in to work. but without making any kind of profit. So they've been supported anyway. Wouldn't it have been amazing if we could just have been doing that anyway? And if we took that money from the Sheriff Hall roundabout, I wonder how many buses and different things we could support as well in doing that. We've always had that thing about, oh, there isn't the magic money tree till we have a pandemic, and oh, wouldn't you know that there actually can be at times. So we need to look again at how we are funding. We need to look at trains. Not everybody's using their train anymore because we're not commuting between Edinburgh and Glasgow, but there is such a huge opportunity there to think about the pricing rather than putting them up, to actually think about spending the money on that rather than spending the money on any more road building at all. That has to be a moratorium on that, and actually really considering the impact of the price, because that's what also, and the free transport that has now come in for young people across Scotland is, we're getting there. To think, oh, Irene, don't be crazy, we can't do that. Well, we've just done it for a large proportion of our population and made it free for them to get around by public transport. So why not?
Yep, Caroline was just flagging that for young people up to 22 in the new year. Yes. So thank you so much, Irene. I think it's always a good sign of an excellent seminar when you have to stop the questions coming in at the end and leave people with their hands up in the air. So it's been fascinating and really inspiring, and I look forward to, and thanks also for the pointers for research questions for our students, and we look forward to seeing what happens with the local project towns and to follow what comes out of that. So thanks so much for your time and coming along and talking to us. And thanks to the audience. Thanks for contributing your questions and comments and making this a lively discussion at the end. Everybody, look out for the next seminar. Just keep an eye on our programme. Okay, thanks everybody.
Thank you. Bye.
Thank you, Irene. Thank you.